well know that you've been guiding me for so nicely. And to be honest, I was affected with COVID also, and I was going through horrible times. But with doctors' timely management, and guidance, fear just vanished, and I could just smile my way back out here, and I'm in front of you. I don't know then after that how many times I've been infected, but the fear of that virus is gone. Yes, but the awareness of the symptoms has increased. So, Dr. Lim, my question here is, should we think about the virus, or should we think about what the virus does to us, the symptoms?
It's not possible to think about virus, Rajesh. Now the variant in India, more than 200 virus now. Okay, if you study one virus after the other, it will take you years now to study the virus now. By the time you study all the virus, the new variant that come out again, okay, that is an endless loop, okay. So in our system, it's like that. Whatever is the virus, one thing is the same, the symptoms. Okay, so when a person is having flu, whatever kind of flus, a few things. First, the fever, they develop fever. Secondly, the aversion of cold. A few tears, thirdly, the body pains, the joint pains, the headache, the pains, everything. The symptom always the same. So whatever is the virus. So now our proposal is very simple. Focus on the symptom. Because the symptom is constant. The symptom always there. Always the same symptom. Forget about the virus. Okay. Do not treat the virus, but treat the symptom. Okay, and today, Rajesh, I think our session put to 3 sessions. First, we are talking about our experience with viruses. With the extent that we have been dealing with the virus from the very first day we established a company, not only today. Okay. Secondly, we also try to put some theory about flus. What is type of the flus? What are the common symptoms? Okay, what can we do about that? After that, we open the session to all the doctors to communicate with us or whatever question that they wanted to ask. This thing. And do you need any translation today, or we translate after the session?
No, I don't think so. We need a translation because this is a doctor's forum. Yes, later on we can summarize it for the audience, but right now we keep it as a very open and general discussion in English because all the doctor panel is here. In the end, maybe I will summarize it for the people in Hindi.
Okay. So now we start the communication. First, you look at ourselves now. So maybe myself is the product of the theory, Okay, you see, for the past 30 years, I travel widely in the world. So I seldom spend 3 nights, in a place for the past 30 years now. So that I go around and view then the chain of environment, the chain of the timing. Okay, the chain of food. Many times my assistant falls sick now. Okay, but I do not remember for the past 30 years in my traveling. I never catch any flus. I never catch any flu because before the flu comes, there are telltale signs. There are certain symptoms. And we know the flu is going to come. Okay, the first symptom is fever. We do not need the thermostat now to know the fever is coming. You see, let's say in a room, okay. Suddenly, one fellow feel that the room is very cold, chilling. But other people are not feeling chill. I mean, this fellow definitely is going to develop flus and fever. Because why? Because we detect the surrounding by the temperature gauge. Because the temperature of our skin is about 36 to 37 degrees. Okay, then we compare to the temperature of surrounding. So if the temperature of surrounding are lower, then we feel cold. If higher, we feel this warm. So normally in a room we adjust aircon, these things, so everything feel comfortable. Then suddenly someone is feeling cold, is feeling chill. That means the temperature on the skin is already raised. You do not need thermostat, you don't need thermometer. You already know the temperature is come. So sometimes when you feel chills, even before the fever has come, you know that fever is coming soon. Okay, so we have this kind of training. Okay, this is the thing. So what should we do? So when you have chills and everything, okay, this thing. So the easiest way is to induce perspiration, a little bit of sweating. Because a little bit of sweating, you have two effects. First, detox, Because when the flu attacks us, normally attack on the surface first. That's why you feel the headache, you feel the pains, we all the nerve, you feel the pain. Secondly, it affects the lungs, no? Okay. Then we have coughing, we have this asthma, what they call the grasping for air. Then it affects the stomach. Then your nausea, your vomit, you have this stomach pain and all these things. Okay. But before the thing goes serious, no, first thing first is the aversion of cold. I mean, you feel any wind or any cold, you feel chill, you know, you feel chill. So the most effective way, okay, is induced perspiration. Okay, now you see the characteristics of cold. Okay, first, you feel chills. Secondly, is having some fever. Thirdly, the body feel painful. No? What is the best medicine to treat all these things? It's paracetamol. Paracetamol is the best one, you know. And theory is not invented by me, you know. It's invented by this Zhang Sichun in the early 20th century, and he also the advisor for the military, you know. So when they must transport the army, you know, a chain of, because when they travel in the train, they do not close the window. Many people are exposed to wind. By the time they reach, many people are having cold. Okay, so he using this warm water. Okay, adding with some sugar. Why sugar? Because sugar is very important to activate the stomach for detox. Okay, for detox. You don't put sugar, it's not so effective. No. So put sugar, warm sugar water. Taking this, he's using aspirin. He's using aspirin. So now you can use aspirin, you can use paracetamol, you can use this Panadol and paracetamol. They are all the same category, and you can also use any painkiller. No, this thing. Then you keep yourself about 20 minutes to 30 minutes, no, to wet the skin. Now this is important, no, to wet the skin, not a lot of sweating, no, not induced until the whole body sweat, no, just to wet the skin a little bit, and normally the symptom will disappear. This chill, everything will disappear. No? This is the thing. Maybe I give a few examples. No? Okay, then you can understand better. Okay, many years ago, when I'm in Ethiopia is highland, no? Very cold. No? At night, it's only 2 degrees, 3 degrees. It's very cold. No? Then our stockist, Mr. Amma, he just come back from America. The time America is in a summer, no, 40 degrees. So when come back to this Ethiopia, suddenly the temperature dropped to 2 to 3 degrees. So he get a very bad flu. And he told me, you know, he said, Doctor, I'm very sorry, you know, this trip I cannot entertain you much because you take me at least 2 weeks, no. And he give me 2 bottles, no, of drugs, no. This is a thing, no. To overcome this problem. Then I asked her, this bottle of drug, is it helpful? Even with that, no, take 2 weeks, no. Take 2 weeks, no. Then I told him, bring me to the supermarket. So when you go to the supermarket, I buy some leek. Your leek can you see, leek, onion, this spring onion, garlic, all these things. When you take hot, you feel the perspiration, no. Okay. When you have perspiration, you must control, no, so that it should not over this sweating. No. Then we use tomato. Tomato is good to regulate the body. Okay. Then the stomach, no, we need to protect the stomach. Okay, this thing. Then we're using ginger. Okay. Ginger also can improve the circulation on the surface, and also together with the dates. This you know, now is the fasting month. Before they open the thing, is the kind of Arabic dates. Okay. Only for this thing, boy. And she told me, and the next day, you know, when she called me, just super excited, you know. He told me she sweat throughout the whole night, you know. Sweating. But of course, not excessive sweating, but I told her not to sweat excessively. Normally, when you sweat like this, the next day, you'll feel dryness on the throat, you feel very bad, you know. You feel very bad. But after that, they say the throat is not dry, you know. That is due to tomato. It's due to tomato to regulate the body. And the whole symptom disappear in one night, you know. In the night time. These are the things. Okay, the chills, the fever disappear. Okay, this is on the flus. Not only flus, no, even on virus. I think you all go through my video. I always put this in Singapore. Rajesh still remember. There is one very rich man in Singapore. Then he traveled to China, no. Then he contacted some unknown virus. Nobody know this thing. So he is rich. So he go to the University of Singapore. He go all the hospital, no. Okay. Then I think they check the body. They know that this is virus infection. But they cannot identify the name of the virus, no. Then the body deteriorate, no. No? And this one attack the kidney. Attack the kidney. The kidney started to fail, face become this deposit, you know, become very dark. So they had to hold him, you know, to come to see me in Johor. The time I'm in this neighbor of this Singapore. So he told me that he contacted the virus now. After checking for 2 to 3 months in the hospital, no, he still cannot identify the virus. Then he asked me one very stupid question. No. He said, "Doctor, do you know what virus I'm suffering from?" I'm telling you, no, you go to the university, you go to the best hospital, no, you check for everything. They can't even tell you what virus you are suffering from, and you meet me for 3 minutes now. How can I understand what virus you're suffering from? Then he said, okay, even you doesn't know, no, I'm doomed, no, I'm going to die. I said, wait, not so soon, no, not so soon, no. Now, what's the problem with the virus? First, virus mutate very fast, no. Some professors, say even 20 minutes or even 1 or 2 days, they started to mutate, you know. Okay, so even you have some medicine to, even some vaccine, you know, okay, you can treat the virus. After they mutate, like you said recently, there's one very famous pandemic. A doctor come to India. He died of COVID, you know. Why? He already take two vaccination now. Pick your vaccination for strain A, you know. When you come to India, it becomes strain B, strain Z now. No, your vaccination becomes not effective now. You're not effective, okay? So I told him that the only thing that can react faster than the virus is your immune system. No matter how the virus mutate, you know, okay, your immune system always react faster than that. If not, a human being will be extinct million years ago. These are the things. So I told him now there's a race, no, between the virus and your immune system. So which one run faster? Okay, if the virus run faster than the immune system, sayonara, bye-bye, you go. This is the thing. But your immune system run faster than the virus, okay, then you survive. We are not talking about killing the virus, no. But the immune system don't kill the virus. Okay, they just discharge two things now: sweat and urine. Sweat and urine. They are two from our experience. So the Singaporean man, I told him, no, you just go for the megalosis, no. Take a lot, no. Forget about virus, no. I told him, don't think about the virus, no. Then of course, in about 2 weeks time, no, he become very well. Okay. Then eventually he is treated now. Okay. Then he come to thanks me after the thing. Until today, we still doesn't know what is the virus now. So Rajesh, you get the point, right? We treat the body, we don't treat the virus. The virus keep on mutating how to treat the virus, no? Okay, you put a vaccine. Now, of course, we are not against the vaccine now. Vaccine will be good to this thing. But vaccine is not the ultimate solution, you know. You see, the doctor, he already get the vaccine in America now. When he come to India, he is facing a new strain. And that of COVID, no? And that of COVID is very unfortunate on that. Okay, so now the first thing that we are going to talk to all the doctors is that get the virus, no? Think of the body. Okay, so if you manage the symptom, if you can remove the symptoms, no, it's the like your case, you still remember, like this, the time the symptom is there, then we say, hey, don't stop the film, no, moving up all the film, then all this thing come out, this thing, then you induce some testing. After that, actually, that may be good because that itself is a vaccination, you know. It's like vaccination, it's disappear. The symptom, when the symptom is gone, the flu is over. It is over. It's a thing. I can tell you another case is that, okay, we have one case in East Malaysia, you know, Tawau, and that's very far away from us, no. The sons are in Langkawi. It's where I am now, no. This thing. The mother talked to him, and she's crying, no, crying for hours, no, asking for help. Very serious, no. Admitted to the hospital. This thing. Then the mother call him one evening, no, that she feel very tears, no, it's very tears and panting, no, and gasping for air, no. Then he told the son he may not last for tonight, he may die very soon, no. Then the kids keep on crying, no. this thing. So I told our member, it's good that we have so many DX members, quickly go to the hospital, and luckily the hospital allowed us to bring in the parcel with our products. No, and I go for Megado Safe and this warm sugar water with this Panadol with 1,000 mg of Panadol. Next day, everything became okay. No, in 3 days time, I admitted out from the hospital. So we have so many of this kind of experiences. No, so we are not like those quick system, and they say, oh, you put some lemon into the system, you put this and then you can treat the flu. Not like that. No, it's not like that. No, we are a system of diagnosis. No, and based on this system, we're using this formula: system A, formula A, system B, formula B. Okay, so that there's a little bit of background. Okay, I myself is an example. Okay, we seldom catch flu, and I never have headache. When I have headache, only one thing, something wrong with the food. They must have put something on the perfume. I'm very sensitive to perfume. If the perfume is natural one, I don't have headache now. If the perfume is a synthetic one, immediately I have headache now. So my body becomes a bio tester. Biotester. These are things. So these are the experiences that we have, Rajesh. Okay. Yeah. So I hope this sound clear to you. Yeah.
Yeah. Very, very clear. So whatever challenges, some people, I just got some messages that they cannot hear on the live. So maybe the people can get in touch with Vijay for that. And as doctor said, yes, there is a way you can manage this, and that is how he helped me manage it. And I, on one side, do listen to doctor, but on the other side, I go and verify facts also, personally by experience, and then also by theory. And what I did was actually, I went after I heard what doctor said from Shangalun, that this is the way it's treated. And I'm very proud to be an Indian. So I always believe that the roots of everything comes from India. So I immediately went and looked into the books of Ayurveda, and there it was. Whatever doctor was telling, with a lot of masala, even we have it. But yes, the concepts are the same. You definitely need to induce sweating. You definitely make sure that your fluid balance is good. You definitely need to, manage your symptoms. That is what everything is all about. And that's what doctor is telling. So yes, while we have, doctor keeps on sharing and giving us, doctor, it would be good if you keep it simple for those people, if you could give us a line of management in the initial stage when people start getting the symptoms, how can we manage it?
Yeah. Now come back to Sangalun. I think Chang Chung Ching classified flus into 4 categories. Now the flu always attack the surface. Okay, and there are 2 kinds of surface now: external surface and internal surface. Okay, the skin beside that is external skin, but the lining of the lung, the lining of the gastrointestinal system, and also the lining of this bladder and also womb of woman, okay, that is also skin, that's internal skin. So when the virus attack, they always attack this area first, from the skin first, because it's exogenous section. Exo means external, okay. Now, then based on that, there are 4 categories of depending on the organs. Now, first, if attack the lung. So when you attack the lung, then of course, first they are coughing. Cough again. Then after that, when the lung attack, the phlegm and water started to accumulate in the lung, then the patient will start to have difficulty in breathing. This is already well documented about 2,000 years ago. So they have difficulty in breathing. This thing. What should you do? Okay, what should you do? Okay. Now we talk about treatment later. Now we classify the disease. Secondly, is the stomach flu. Stomach flu attack the stomach. Okay, then you have the stomach pain, you have the nausea. Okay, you have the vomit. Okay, then some people have constipation. Some people even have this they have this loose motion. Okay, this is on the stomach flu. Okay, then he also attack the muscle. When he attack the muscle, these are the headache. There's a stiffness of neck. The neck become very stiff. Then the body pain, especially the joint. The joint pain. Then what you do? Okay, last is on the urinary tract. It attack the bladder, the urinary tract, and for the woman, it attack the womb. Okay, this thing. Then you have this difficulty in urination. Okay, now and COVID flu, COVID is classified under lung. because COVID is a attack on the lung, okay. Then the difficulty of breathing is for sure they're going to have a difficulty of breathing. Now you look at the present treatment now, okay. When people have difficulty of breathing, you give them oxygen and all. Is that effective? It's not effective at all. No. When you get the oxygen, the flame is still inside the lung. The water is still in the lung. So we should give something, to expel the flame, the water from the lungs. Okay. Of course, Chang Chung Ting use ephedra, Ma Huang using this ephedra, and also using this apricot kernel. But unfortunately, Ma Huang is restricted. I think even in India, many areas. You know why? Because of Ma Huang is induced perspiration. Okay, when induced perspiration, okay, it's supposed to be wet. Wet your skin will do. Okay, but some people after taking it, they feel good. Then they take more. The over induced sweat. Over induced, you a doctor? No. Over induced sitting, you're going to face ton of problem. Dehydration. And people, there are some cases fatal. They died due to dehydration because of the mahang. And also and after that, heart attack. When your body is dehydrated and then the arrest of this thing and the bite. But if it's under the doctors, of course, it's very safe now. Okay, forget about mahang. Forget mahang. You paracetamol. It's the same effect. You can induce. Of course, you do not over-induce your body. Then apricot kernel. Now, apricot kernel in India there's a lot, but this is in emergency. You cannot get apricot kernel. What you do? Lemon. Use lemon. Also citrus now. Calamansi is the most easy. Calamansi and the bitter lime. Bitter lime. And then the oranges. Oranges is the one you can peel the skin. Okay. And this the sunkiss, then you can peel the skin and also lemon. Okay, listen. Oranges is very good for stomach. Okay. Then this what they call this sunkiss. Okay, it's good for this good for the lung and also good for the liver. But what which is the same thing now. So we chop the whole thing. We think with the skin. Remember, wait, you do not throw away the skin. Okay, the skin is very important to act like this. It can induce the what you call induce the sweat on the skin, and also it can push the flame from your body. So Rajesh, you still remember the time I asked you to cook the oranges, together with this tomato, oranges, tomato, and also this date. When you do dates, use sugar.
Yeah.
You use a lot of sugar. When some of sugar, a lot of sugar. We are not treating people now. Even people with diabetes can take. After all, how many food can get in a year? Okay, 3 to 4 times and take a paracetamol, take the thing, it doesn't affect your health much, Okay, that's why DXN, we go for the integrated approach. Okay, we whatever this thing, the doctors or they can free to apply the Western medicine. We have no worry about that. Okay, you apply what is familiar with you, but one thing, when the lungs, COVID is a lungs flu for sure. Okay, so that you can induce the sweating. Secondly, is that you direct the what they call the lung. So let the flames, let the water. When you induce what they call perspiration using oranges, using orange thing, the water in the lung will be reduced. You using cinnamon to induce. Cinnamon also can induce the perspiration. What is the difference between cinnamon and oranges? Oranges also can induce this thing now. Okay, the organ not the same. The cinnamon normally to reduce the water in the stomach. So when your water congested in the stomach, you always feel nausea, vomiting, So you take the cinnamon, you induce this thing, then the water this thing. But to reduce the water in the lung, you to use citrus, any kind of citrus, any kind of citrus. Okay. Then these are the things. So you need to induce perspiration in one hand. The other hand, you also need to control, not to over to control. We in Chinese they use ponia. This ponia roots. But in India, I don't think you can get this. So, but we can use this. What they call this tomato. A tomato, not a small one at all. This is a big tomato. And if the tomato, the more sour it is, the better. Because sourness can stop breathing now. Can stop this sweating. But nowadays the tomato becomes sweeter, no good. We want the sour one. This thing. Then after ginger. Now, ginger also can help you for perspiration, also to take care of your stomach. Then dates also very good. Dates give the boost, boost the energy, boosting the body system. But now the fasting month, you can get the dates easily, you know. Like the Muslim, before they open the fast, they say, yeah, that kind of dates, because they palm dates, palm dates. But in case there's no date, put in sugar, you know. Of course, the jaggery is the better. Jaggery is a natural sugar. If not a brown sugar, if not, I do not everything, put in white sugar. Whatever it is, these are the thing. Don't be too specific. You whatever is around. Okay, and don't make it too difficult for the patient. I believe these are simple. These are things we can help. So now we talk about the. Is that clear to you, Savina?
Yes.
Yeah.
Yes.
Now about the development. There are 4 stages of development in this flow, 4 or 5 stages. First is they only feel chills and fever. Chills and fever. Okay, and this chill and fever maybe a little bit of cough. The cough is not serious. The fever is not serious. That's the first stage. Okay, that can be easily solved by using this induction of perspiration. Okay, they mean what they call sugar water, warm sugar water, plus paracetamol or aspirin, okay, or Panadol or even some painkiller, Okay, you take, then it sets out. Then like paracetamol or like this Panadol, they themselves are painkiller, so that the body pain, so you also can relieve at the same time. That's the first stage. After that, if you put the patient started to have difficulty in breathing. They started to have difficulty in breathing. Okay. Now you can give oxygen, but oxygen cannot solve this problem. Definitely cannot solve this problem. People they still die after giving oxygen. You give oxygen, but you don't deliver the frame. You don't deliver thing. Then the frame keep on accumulating in the lung now. So die. The treatment. The treatment is this thing. So the oxygen only relief, is cannot treat this thing. And to treat this thing, remember using these oranges together with pills. Okay, and also with this apricot kernel. Now, apricot kernel, what do you call it? You can blend it. You can blend it now. Then you can boil it. Then it tastes like milk. It's very nice. Okay, sometimes we can use that. I can drink it like milk. Then you can open up your lung and all the flame will come out. All the your frame this thing, and also take the oranges now. You shake, when you shake, you reduce the water in the lung. These are the things. Then we ask the patient, to breathe in quickly. Keep on fast breathing, fast breathing for 50 times, 60 times. Then you can increase the exchange of air. These are the things. So this is the second stage. Okay. When come to the third stage, then the virus attack further. So the main symptom is alternating between chills and fever. Sometimes the chills stop, then the very high fever. Okay, then the chills come again. It's like malaria. A little bit by this alternating, then we call it internal system. It's a halfway going into the body. So and the main treatment for this again is oranges. Oranges is very, very orange and lemon. It's very effective. You have to put more. Or you have to put a whole orange 100 grams. You put more, the same thing. Then you boil the soup and you drink this thing. Okay. Then this is the third stage now. The last stage of into A and B. The last stage of very high fever and the what they call the patient they are fighting for air. They're fighting for air. Then sometimes the fever comes very high. When fever comes very high, it's a good sign. That means he's still strong. Okay. Normally they can survive. Okay. But the case is no more fever. The fever. That means the patient is already exhausted now. His body already adjusted now. If you don't treat him, he'll die. Okay. Then at the last stage, when the high fever like this now, okay, we're using gypsum. Using this gypsum. Gypsum, you can boil it. Okay, you can boil the 30 grams gypsum, boil and drink the gypsum water together with the soup. Okay. And another one, we can use the pearl powder. Pearl powder also, two types. One is the true pearl powder, and another one for the cell. Even for the cell, even for the what they call using the cell, using the oyster. The powder, you can take about 3 to 5 grams. But the one also can come down to high fever. It's very effective in the high fever. Okay, but what is risky one is that those the fever is no longer that serious, no. Okay, then only asking for what they call gasping for air. That means the body, the metabolism already seriously weakened, you know. So if you don't treat them, they will die. This is a very serious case now. So it is a case we boil this aconite. Aconite is a very poisonous plant. You take it raw, you may die, you know. Okay, this thing. But as a doctors, no, when during emergency, you know, we use poison. We don't care anymore. No? To save the patient is our duty, you know. Okay, but normally aconite you boil for 1 hour. The protein, the thing is already okay. Then it can why aconite is a poisonous, because it make your heart pump very strongly. Normal person you take aconite, you are going to suffer now, because your heart is going to it's a heart stimulant, you know. Your heart will keep on pumping like mad, you know. It's this thing. But for those patients is going to die, you know. Suddenly then the whole body will be loosened up. Okay, this thing. So let me summarize. So I think five stages. The last stage. The first stages is tears and fever. Tears and fever, you induce perspiration. Okay, by any means, you can use herbs, you can use onion, you can use leeks, you can use this what they call this spring onion together with this tomato. Now you can induce, or you can use a warm sugar solution with paracetamol. Okay, sugar also can control your sweating. You know, can control. You will not you prevent excessive sweating. Then after that, okay, the patient started to gasping for air. You know, then the lung is already affected. Now, then you put in oranges. Then if possible, we also introduce this apricot kernel. Okay, can put into the soup. Okay, or blend it into like milk, you know, boil and just drink this thing. Then I come to the stage. Okay, the fever and chills alternating. You know, sometimes the chills are very cold. Sometimes they become very high fever, and like malaria. No, on and off. This critical. Then you have to increase the amount of this lemon, you know, oranges, lemon, you to increase the amount. Still the same thing. Boil this thing. Now, if it's a general knowledge, if the energy of the patient become very weak now, no? Okay. Now, if you boil carrot and sweet potato, or you don't have sweet potato, you get a potato together with sugar, together with onion, you know, you can boost the energy immediately. Then the last stage of very high fever and gasping for air, you know, and then the oxygen content is already lower than 80%, very critical now. And this is the state where the patient may die, you know. Okay, so the high fever, we're using gypsum. Gypsum is easily available in India also. These are food grade gypsum of 30 grams. Okay, boil. Okay, then drink about 150 to 200 cc of that. But normally you can put it into the soup, you know, and boil together and drink the soup. Drink about 200 cc of the soup. When you drink the soup, throw away all the spent vegetable. No? Don't take the vegetable. Drink only the water. Okay. Then the last stage when the patient are exhausted. Okay, he only pending the air, but cannot move anymore. The body is not very weak now. Then doctor can inject the what they call the heart stimulant. You know, I think heart stimulant is easily many doctors they have. You know? I don't know why they don't. Then they let they put in the what they call the herbs and everything to boost the body. And for the herbalist, normally we use aconite. Okay, that is to treat the system. But that's not enough. No, come back to DXN. No, normally we put mega dosage of our products. What do you call 30 RG and 30 GL and 30 spirulina. Okay, this sort of thing. So now we are mass producing the spirulina for the malnutrition. In India now, we give it very cheaply, you know. We sell it very cheaply to the market. Okay, so now we are going to mass produce the GL also. The GL also for this purpose. Okay, then it's about 30 grams per day. 30 grams per day. Okay, so we try to cut down the cost now. And maybe normally we give it 7 days. 7 days, 1 week is one treatment lah. Okay, this so 30 grams a day, it takes about 21 grams, 210 grams lah. 210 grams. So we try to make the thing cheap so that each treatment will cost them less than what do you call? Will cost them less than 200 rupees. Maybe 100 rupees, 200 rupees in that range. So that we can mass open up. But of course, we cannot give to the member. The members simply give. So we will appoint the panel doctors. Okay, only panel doctors have the right, to advise to this thing. Now, to boost the immune system is very, very easy now. It's not the whole world. Okay, many doctors now, they never use paracetamol. They never use this what they call this perspiration of all these things. They only give DXM products now. We get so many beautiful results. That means our immune system is very important. So if we forget everything, just apply mega dosage on the products now. Okay, then this treat not to say treat, you manage the patient very, very, very effectively. So Rajesh, I hope this is clear to you, Rajesh. Yeah.
Yes, it is definitely clear to me. But now let us ask the people here, the doctors here. It is clear for them, and we open them, so that they can also, because they have been waiting to ask you questions. I think we can open the forum, and people can definitely ask the questions. Yeah, the doctors only. Okay, please keep it limited to doctors only, and introduce yourself so that we know that you're a doctor.
Yeah.
So, good morning, Dr. Savera. I'm just opening the mic for all the participants who are inside the Zoom meeting. I would like to request, as Dr. Savera said, that only the doctors will unmute their mic. Please cooperate with us.
Yes.
Now it is open. Now the doctor can unmute their mic themselves.
Good morning.
Hi, good morning. Good morning. Can I ask a question?
Doctor, your audio. Yes, doctor.
Can you listen to me, Rajesh? Good morning.
I can hear you, Asma. You're doing. How are you doing? You're doing good, I'm sure.
Alhamdulillah. Thank you very much for this fantastic event. Thank you, Dr. Lim, for being there for us. No words.
Let's find where is Dr. Lim. I want to just check whether he's there.
Can you listen to us?
Yeah, doctor. Yeah. Yes, doctor is here.
Yeah, please.
Asma, please.
Okay. Thank you very much, doctor, for briefing the situation and the effect of our products on COVID. But as doctors are facing great trouble to let the people decide when to start and when to improve the dosage for our products. I think all of us here are using our products, and they know the efficacy of it. But regarding the different stages of COVID, can we have some recommendations from you that how much and the increase in the requirement of individualized patient we can move to, and when do we have to decrease it? So this is like indications and limitations of our products dose. Is it clear, Rajesh? Can you hear me?
I can hear, but doctor, your volume.
My volume is okay?
Yeah.
Now.
Yeah, no.
Doctor, did you understood what I said? Should I repeat the question?
I know.
I can't hear you, doctor.
I think, Dr. Lim, I think there is a problem with your audio. Maybe we have somebody's audio getting disturbing. So after you ask the question, you can mute yourself,
Yeah.
Doctor, your volume. Audio. I can't hear you.
Cannot.
Vijay, you mute everybody. You open only doctor volume now. You mute everybody now.
Okay. Yeah. Can you hear me now?
Yeah, it is.
Yes, it is clear, doctor. Clear, yeah.
Dosage, only 1 dosage now. Mega dosage. only 1,000 dosage. Okay, 25 to 30 grams of the products per day. 25 to 30 grams. Start up from the very first day. So that in 1 or 2 weeks' time, I want to solve the problem. You don't say, oh, this case dosage A, that case dosage B, there's only 1,000 dosage. Okay, immediately we give this thing. The only problem is the cost. Maybe some people they cannot afford this kind of cost. Then okay, then you can supplement with the vegetable soup that I explained. Okay, and in the future we are going to supply to the doctor with a subsidized price, so that these our products can be given to the patient in a very cheap form, in a very subsidized way. So that's the only answer to the situation now. Do not confuse the patient. Do not confuse the society with too many dosage. There is only one dosage now in this case. Yeah, is my explanation clear?
Yes, doctor. I think that was a answer very clear. That for this condition, when you're talking about COVID, or basically mega dosage is the answer. Keep it simple, any stage. Okay. Yeah. So any other person who wants to we have Prashant. Dr. Prashant, please unmute yourself.
Yes, thank you, Dr. Rajesh, sir. And good morning, Dr. Lim. Sir, actually, I want to share my personal experience. Before that, actually, I am working as an assistant professor, and since last 15 days, I am working in COVID wards. And till date, actually, my family members never suffered from COVID. And since last 4 years, me and my family members, we are taking near about 5 pairs of RGGL and around 10 spirulina every member since last 4 years, more than 4 years. And on 29th April, some days before, my son complained about he woke up and he complained little fever and weakness. So I immediately tested him. So he is COVID antigen positive, and my family physician, he suggested to give some ivermectin, vitamin D3 plus vitamin C. And immediately I started mini mega doses to him. So I had given him 15 RG, 15 GL, 15 spirulina. So on the third day of starting these doses, I increased RGGL near about 30 RGGL and 30 spirulina, and his fever subsided on fourth day. So now he had no symptoms, and his fever also subsided. But my wife, so he's taking care of him. So she also having symptoms since 2 days, and she had dry cough. She do not have any fever. She do not have any weakness. And actually now these COVID symptoms are very much atypical. People are not getting typical symptoms like only fever or chills. Atypical symptoms are also there, like dry cough. They are starting with only cough. And I also tested for her, so she is also COVID antigen positive. So immediately, as a precaution measure, before testing, I started mega doses even for her also. But I feel that along with allopathic treatment, as you said, integrated approach is very much necessary. So along with whatever antiviral treatments that are available, whatever current treatment that is available in allopathy, we should use mega doses. What is your opinion regarding, and how much days we have to use these mega doses if we had symptoms? And this is the first question. And second means for contacts, those who are living, how much doses they should take, whether they should also start mega doses, or they should start the treatment that you given, that is along with mega doses we have to induce perspiration, and we have to start like tomato, ginger, oranges. This is also very much necessary. So what is your suggestion? That I want to ask.
I think that's a good question now. For flu, we take 1 week at one cycle, one treatment cycle. Okay, for those who already confirm this COVID, it's better that we use 2 cycle treatment. I mean, you put mega doses for at least 2 weeks, at least 2 weeks now. After 2 weeks, if all the symptoms already disappear and he already become normal, then you can reduce by half mega doses. This is common sense, okay, for 1 or 2 more weeks now. Then when everything becomes normal, okay, then we can go for the maintenance dosage. Maintenance dosage is 6 RG, 6 JL, and 6 Pyrena. These are the maintenance dosage, okay. Now, let's say your family is everything okay, no one is having COVID, okay. So 6 RG, 6 GL, and 6 Pyrena is the common to maintain, to maintain. But someone already contacted this COVID. The one who contacted COVID go for mega dosage, and those who have not committed have not contacted the COVID now go for half, 15 RG, 15 GL, and 15 Spirina. Okay, of course, many people to be safe when the economy is okay, they also go for mega dosage. Okay, so I repeat now, to maintain your family, no one is having this COVID. To maintain it, 6 RG, 6 GL, and 6 Spirina. Your case, no, okay, you have 5. It takes for a long time, of course, your immune system is very, very strong. But unfortunately, if someone already is suffering COVID in the family, the one who suffered COVID should immediately go for the mega dosage for at least 2 weeks, no? Okay. Then those who are not suffering from that, taking care, go for half mega dosage. And those taking care one in the close proximity also better we take this full mega dosage. These are common sense. Okay, this is common sense. Now come back to what they call induced perspiration. Induced perspiration is very, very important. No? If they are having fever, because if you induce it together with mega dosage, okay, normally the fever will be taken care between very fast. No? Some as quickly as 30 minutes, some in 2 to 3 hours, then it never elapsed. No? The fever never come back. So that with the induced of perspiration, we shorten the symptoms, no? And then of course for the doctors, for the doctor. Then other than this, we use paracetamol. Paracetamol also can reduce the body pains, for the pains and everything. Of course, as a doctors, you can always use any this perspiration, what they call any drugs, no, to induce the perspiration. It's up to you. Okay. Now this I think at least 2 weeks. For the mega dosage, no? Okay. Normally, if you treat them well, within 1 week, all the symptoms disappear already. No, disappear. So as quickly as 3 days, 2 days, 3 days, if they just started to get the COVID, no, normally in 2 to 3 days, the symptoms are over. And those who have a serious one, seldom more than 2 weeks. When we treat them with mega dosage, we have got most of them within 2 weeks. Within 2 weeks, yeah. I hope I answer your question. Yeah.
Okay, anyone else? Yes, Dr. Malti. You need to unmute yourself first before you speak.
Unmute yourself, yeah.
Hello, doctor.
Yeah. Hello.
Dr. Malti.
Long time I not seen.
Nice to see you. Long time never seen you. Very happy to see you. You are my guru. Talk about you.
Yeah.
Very happy to see you, doctor. And genotherapy, we had the classes with you. I do in my clinic every day. So I tell my patients the greatness, the guru from whom I learned a lot of things. Now my one question is, because this COVID patients we are seeing a lot as a practitioner, but especially in the diabetics, when the steroids are given, their immune system gets compromised. And then I don't know whether you are aware, this mucormycosis is the latest problem now we are facing, which is affecting the blood vessels, the nervous system, and the brain. And ultimately, they have surgery. Our antifungal measures are all very costly. So usually I suggest mega dosage of our RGGL, but I want doctor to highlight on this fungal infection, whether our Ganoderma and spirulina in combination can help the patient or the no-need use, so that I will be able to guide them better.
Now you see, those dead cases in COVID, these diabetes are very high percentage. No? Those people with diabetes, with hypertension, with this heart, this problem, majority of them they die. Due to simple reason, the immune system is low, and their metabolism is low. Okay, but whatever it is now, we don't look at diabetes. We look at the body condition now. If the metabolism is low, we go for this we go for this mega dosage. Okay, if after mega dosage they feel very big, then you have to inject something to boost their heart, whether they are diabetes or this thing, to that together with mega dosage, then in a few days time you can see good result. Okay. Now, of course, when for allopathic doctor, they can always put some booster, to boost the heart. The heart may not have anything to do with diabetes, but because due to the weakness of the metabolism, okay, this you need to what they call emergency, you to use. Then of course, in those people in the village and this thing, when they don't have access now, okay, if they don't have aconite, then the cinnamon also can work not as good, but of course in many cases also we save with cinnamon. But cinnamon is very easily available in the market. Get the thick one, get the thick one, then boil, then drink, or put in the powder and drink. Then you make the heart pump faster. This is a thing. So that we don't look at the patient as diabetes or as this hypertension or this thing. No, we look at the metabolism. So if the metabolism becomes weak, we give them this mega dosage. So in a 2 to 3 days time, if they still don't improve, then you boost their heart. These are the normal way we are going to do. Yeah. So doctor, I hope I answer your question.
Fungal infection is a very common cause of the immune system. How does our Ganoderma can help them? Because our antifungals are very costly. Not everybody can afford it. It is 8,000, 10,000 injections cost. So I would like you to highlight, because many doctors are here, it will help them. Because Ganoderma itself is the biggest fungi. So how can it help?
Ganoderma was very good to fight the fungi, the infection also. Okay, so it's the open infection of wound. Of course, just apply the powder. Apply the powder. Now, if the infection on the skin, normally we mix the RGGL together with our toothpaste. Mix together, put the water, then apply on the skin. Apply there to check the infection. I think many of our members, they already know that this method. Okay, this is the thing. So that, but again, okay, we don't look at the bacteria, we don't look at the fungus, we don't look at the viruses, Okay, we always look at the body condition. Okay, if it's on the skin, okay, then you can apply the Ganoderma, can apply this together with our toothpaste, mix together and apply. Sometimes they use our toothpaste when during the shower to use it as a soap, to what they call to wash the skin. Okay, this is a thing. So that then of course when a person is having this COVID, in the immune system is weak. Of course, there's a lot of complication. There's some infection. There's this thing now. We don't care now. Give them this mega dosage, because Ganoderma is very, very good to handle the infection inside the body. Yeah, doctor. Yeah. Rajesh?
Okay, great. So anybody having any questions? Yes, there is some Dr. Shankar Vadela. Yeah, Dr. Shankar.
Yeah.
Dr. Shankar, you'll need to unmute yourself first before you speak.
Dr. Shankar,
can you hear me now?
Yeah, I can hear.
Oh, okay. Good morning, Dr. Lim. It's so nice to see you here. My question is, doctor, see, when we give a heavy dosage, the Ganoderma is supposed to be having an antiplatelet action. It's a very good thing. In fact, I want to share my own experience as it is. See, for all the COVID patients, we are giving a low molecular heparin. We are also giving the other medicines like the, we are also giving Apixaban, which are supposed to be blood thinners for most of the patient, during the treatment and post-treatment also. My opinion is, it is better that the person is taking a good dose. Like, for example, before the COVID, during the COVID time, as a prevention, I increased the dose of my consumption. Instead of I'm taking the powder here in Dubai.
Yeah.
There was 2 teaspoons, along with the morinji juice and other things. Now I feel I'm protected with this one. During the same way, I was thinking that if people during the treatment time or post-treatment, if they take good dosage, the blood thinning effect is very good. One may avoid heparin or any of the other things. That's what my personal feeling is. So when my question is, doctor, when you take a heavy dose of 30 capsule, if you quantify the antiplatelet action of the Ganoderma, will it be more causing any bleeding disorder? That's why my worry is.
No, it will not. You know, Ganoderma is not a thinning. It's not a thinning medicine. Ganoderma by itself do not thin the blood. You know, do not thin the blood. Do not cause bleeding. No stop. Actually, it's a regulator. You know? We have a lot of proving now. You see, some people they're having this platelet problem, so their blood cannot stop on, you know, when they have injury. So when they take Ganoderma, they stop, you know. So it's a regulator. So you should not worry that Ganoderma will thin the blood. Ganoderma itself by itself do not thin the blood. It's the body that thinning the blood now. So if a person having to take this blood, this thing, but taking Ganoderma, the blood becomes thin. The action is not from Ganoderma. It's from the body. Okay. Then we also have cases of people have very thin blood, you know. We have very thin blood. So when during injury, the bleeding never stop on, you know. After taking Ganoderma, the bleeding do stop, you know. Okay. That proof that Ganoderma is a regulator. It regulates the blood. It do not thin the blood. So you do not need to worry that after taking the mega doses, no, then the patient may facing this bleeding problem or this thing. No, it will not happen. It will not happen, doctor. It will not happen. Yeah. Thank you. Yeah.
Thank you so much, doctor. Anyone else want to like to ask? Yes, Professor. Sorry, Dr. Ratnavasupal. Yeah, please.
Oh, Professor.
Doctor, you need to unmute. Dr. Ratna, you need to unmute. Yeah.
Okay. Good morning, doctor. Good morning, Rajesh. Just I have got two short questions, but which has very future importance. Number one, some of the specialists have told that those who conceive in this second phase, okay, pregnancy, if they conceive, there will be more chances of congenital anomalies or any type of metabolic disorders coming to the child, because this is a 9 months period. Now it is already 5 months. Okay, second phase has come. So because of the virus transmission speed, okay, and its other activities and double mutant, so many things are there. That's what some reports I have seen. We have to see after the children are born, because we have got among our relatives only some 4 or 5 people delivering this month, next month. So the gynecologists, obstetricians should highlight the family doctors, actually ask them to avoid, because rather than having lifelong problem, okay, for what type also don't know, but 1 or 2 examples they showed in some countries picture they showed already, okay. And another thing is the general question that when we treat it like flu, okay, for maximum 1 week. Usually there is a proverb, flu is such a disease, if you treat, it will be gone by 1 week. If you don't treat also, it will be gone by 1 week. That is, you have to just give time and symptomatic relief. That's all. But my point is, when we give the symptomatic, underlying pathology, if it is anything there, we don't know. Okay. And it accounts that we are responsible for that underlying foundational pathology is allowed to become deepened. Okay. Because these days of legal medicine, legal problems, and people also worry and they defame and so many things. Doesn't matter. We ourselves will feel that. So that's why now that for COVID we do test, but how far the test is really 100% correct. The method in which it is done. Okay. Sometimes it is missed actually. It is not like biopsy. It is only scrapping. Okay. So sometimes it is a problem. Better to highlight it. Better to highlight it and again do it after 5 days. Usually that comes positive first to 5.5 days. Then only the quarantine another 10 days they keep. So these are the two questions which we expect from the to be patient. And finally, when they suffer more, everybody naturally we have to answer them. So side by side, we have to think at least clinically what are follow them and then advise them the relevant tests so that they are also safe, we are also safe. Okay, doctor, thank you. So how to manage that?
Yeah, doctor, I think you put out a very important point, and also the argument for the flus. Okay, flus, whether you treat it or not, 1 week or maximum 12 days, it also disappear by itself. Okay, and if you try to treat it, okay, the problem, doctor, is not treatment, Why a person having problem? Okay, here flu, So what the doctor will do, they do not treat the flu, but they suppress the system, They say the person have a body pain, Okay, you use a painkiller to suppress. Okay, say a fever, you give it to reduce the fever. You cause complication. You cause when you suppress it, by right 1 week the things will be okay. Because of suppression, it become a long-term complication. This is 2,000 years ago. It's clearly discussed in Sanganlun, Okay, you cannot suppress the symptom, Never do that, Okay, this thing. What they say, we induce this perspiration. We do not suppress the symptom. The person, let's say, having this tears, having this fever, we induce this thing together with the medicine. We do not suppress the fever, Actually, the body come up on this thing. This kind of treatment, there is no complication. There is no complication. Okay. Now, let's say if a person is gasping for air, you give them this oxygen, you cause complication. You cause so when you give him the oxygen, maybe he survive, Okay, but the lung will become damaged. The lung becomes damaged now, and you can see. I think last month is one very famous tycoon in America. He committed suicide after COVID. Because he had this ear ringing and difficulty in the breathing. Okay, after the COVID. So the complication after the COVID is due to the suppression. So you as a doctor, we do not suppress now. Let the body system taking care of it. That we agree. That we agree. Now you see, that's why when a person is gasping for air, okay, you give them oxygen. Give oxygen. If you don't do anything, you're going to cause a lot of complication. After that, the body is already accumulated with the frame, everything. If the frame can be discharged out, the problem will be solved. Okay, but if the frame do not discharge out, you get oxygen, you suppress It suppress eventually it survive after they survive. But the problem is not solved The problem is suppressed inside the lung. Then tons of complication a lot of complication. So they always have after the COVID they still have this problem in this lung, and lung also affect the emotion. Then they become depressed. They become depressed. They have a lot of this emotional problem. And lung are associated with sadness, Then they always have the kind of phobia, the kind of this thing, emotional problem, and some are this affect the kidney, Then they are ringing of ear, The ear, this what we call keep on ringing, then they cannot sleep. This thing, we have this complication because you try to suppress the symptom. You try to suppress. Now today very important. Today we are talking about using the immune system, okay, to to deal with the system using detox. It's a kind of detoxification and boost the immune system. So, like you see, the case of this Rajesh I remember very well. Okay, so when they build a system, there's a lot of friends. He started to vomit Okay, so we don't suppress the vomit We say keep on vomit keep on vomit because this is a detox. But some doctor, when they see that they vomit they started to give the anti-vomit this thing. You may kill a patient You may kill a patient because the toxin will accumulate inside the body. Okay, but today, due to the time constraint, doctor, we cannot go for the deeper discussion how the thing go inside the body, what are the complications, Okay, they take a few series for us to explain And now come back to the basic thing. A patient having flus, You don't do anything, after 1 week, the flu will be over. Okay, so why should we do anything? Say the thing now. No, if simple flu is okay. Simple flu after 1 week is okay. But if the flu is COVID, it's not okay now. After 1 week, the complication will come now. It is the complication that kill, It's not the COVID that kill. COVID does not kill a patient, It's a complication, that the what they call the heart arrest, the what they call the liver failure, the stomach failure, the kidney failure that kill a person. It's not the COVID. Okay, so if you do not treat, actually we are not talking about treatment, doctor. We're talking about relieve the symptom. The relief of symptom and treatment is totally different concept. We do not treat the disease. Okay, we just relieve the symptom so that the symptom do not develop further. And this has been discussed very, very clearly in Sangalun. This step 1. If you don't treat this, what will happen next? What will happen next? This thing. But today we don't go deeper to that. So that when a person is having flu, we induce perspiration. Okay, we this thing. Normally 1 week, in 1 or 2 days time, everything will be okay. So that the flu will not complicate further. Now, if you don't treat, then you are taking chances. After 1 week, maybe everything will be okay. Okay, but another scenario is after 1 week, become more complicated. Something fear in the body, and then it becomes a very complicated. So, in our opinion, we are not treating the flu. We are not treating the virus. Okay, we boost the immune system of the body. Okay, help the body to detox. To detox, that is a very different from the kind of suppressant treatment where you try to suppress the symptom of the flu. Of course, then you have a lot of problem. Okay, one problem is the long-term fever, low fever for the long term. Please suppress it, the virus inside of the body, Okay, then again and again, it come again and again. The problem come out again. Okay, we have seen a lot of this. Okay, but I assure you, doctor, if you induce the sweating properly, if you take our granuloma properly, it will not complicate it. It will not go into complication. So hopefully, I answer your answer. This
yes,
thing.
Thank you, doctor.
Thank you so much. Yeah, and I just want to validate what doctor said. Yes, when I got infected, I was staying 3 days in a locked room with a person who was COVID positive in an AC environment. I believe that I had a very strong immunity, and I thought I could, just stay there. Doesn't matter. So inside an AC with a COVID patient for 3 days, and after the 3rd day, I think so, I started to break down. And it became so worse that actually I used to collapse, but then again get up, bring up my energy and still work. But then again get down. I used to collapse. Again, I used to think, I will take and I'll feel good. It became so worst that, I started having bleeding from my intestine. So I had blood-tarry stools. I had a lot of, not cough, you can say, but my lungs were completely inflamed. When I used to check, my oxygen levels were almost around 80 approximately, but something kept me that I thought my end is come. So I said, just bye-bye, sayonara to the world. So I thought, Dr. Lim, I'll first go away. But I believe what doctor said. I did not take any allopathic medicine other than the, crocin, that's paracetamol I took. And second, just to make sure that the temperature doesn't go up. And the second thing that doctor told me is oranges. So I had a lot of orange peel tea that doctor told me, a lot of oranges, and the soup. I think it took me some time, and even right now, I'm just recovering. It's been, doctor, now 5 months, that infection. And now I am almost 98% better. So it took me time to recover completely. So I agree to what you're saying. Do not suppress.
Yeah. You do suppress. You suppress, then it becomes symptom. When you suppress symptom, the short-term problem becomes long-term. And this is discussed very clearly in Sangalun. Maybe, Rajesh, what we can do, so this one is going to be a series, no? Okay, yes. So in a weekly or in a Monday, what this thing, then slowly but slowly, each series we put in more and more theory. So today you talk too much, you're going to confuse the audience now. Confuse the audience. So today you only remember a few things, perspiration, induced perspiration, okay, mega dosage, this thing, and also this oranges, also leek soap. That is a few things is enough for today. And I think we are making the right thing, after today's briefing, a simple write-up of what we discussed today. So those people who are not that clear, they can read the formula, the herbal formula. Yeah.
Sure, doctor, I'll get that. So before we wrap up in the next 5-10 minutes, anybody still wants to ask a question to Dr. Lim regarding this same topic?
I receive that is a message from Malaysia, Emmy, mycotherapist. She wanted to know, that is a reply of one question she asked from you. One who got fever / COVID-19 patient do not have an appetite to consume even a small of veggie soup, especially when he or her smell sense become very sensitive and is getting nausea from time to time. Any other way to induce their perspiration, or same goes to consume other medication, paracetamol, etc.
Now, this is a very clear case of stomach flu complication. Okay, it's having stomach flu also. Okay, you remember we have a lung flu, stomach flu. This is a stomach flu. Stomach flu, we have another session, I think, talk about stomach flu. But to induce perspiration, the warm sugar water together with paracetamol, even the stomach disorder, they can take, definitely can take. It's like, but lick soap may not, Because some people are sensitive to the smell. Okay, they already have nausea, When the lick soap, when the stomach water congested, they feel nausea and they wanted to do, but they may not take lick soap, Okay, so forget about lick soap in this case. Okay, now. Then to strengthen the stomach problem, do one thing. Get the carrot, the red carrot, okay, and also beet also okay. The red beet, carrot, sweet potato. If you do not have sweet potato, you normal potato, boil with ginger, with some ginger, put in the sugar, put in some sugar. Okay. After that, do not take the carrot and do not take this thing. Just the soup, Soup they can take, definitely they can take, in this case. Then after some time they become quite okay, Okay. Now, if the nausea is very serious, if nausea very serious, when the emergency, you're doing this thing, emergency, you know what, many people also they don't like much. Take Coca-Cola. Take Coca-Cola, the gas, then put this thing, then the nausea will gone. This is the thing, because the formulation of Coca-Cola, you look at the history, actually it's for the stomach problem. So those stomach disorder, sometimes when the emergency, we can ask them to take this Coca-Cola, put down the gas of this thing. Then after that we induce the what do you call the perspiration. Okay, these are the things. So maybe I think today we are not prepared for the stomach flus. Maybe in the next series we can talk more about the stomach flu. Okay, Vijay? Yeah.
Okay. Doctor, next question, Dr. Nitin Kunteta. Yeah, please, Dr. Nitin.
Please unmute
yourself. Unmute yourself. Yeah.
Okay, Dr. Rajesh. Good afternoon, Dr. Lim. I'm Dr. Nitin Kunteta from Jaipur. I'm a cancer surgeon here. Are you able to hear me?
Yeah, I hear you.
So my question is for my cancer patients which I operate. And my question is that what doses I should give to my cancer patients of spirulina and RGGL before surgery and after surgery, so that they don't develop or get COVID infection.
When it comes to cancer patient now, from so many years, there's only one dosage now, mega dosage. 30 RG, 30 GL, and 30 spirulina. Cancer, you must go for mega dosage now, because the complication is very quick, It's a thing. Before the surgery, okay, and after the surgery, okay, they say before the chemotherapy, during the chemotherapy, after the chemotherapy, a radioactive, all go for mega dosage. The advantage of mega dosage is that before operation, it makes the body stronger. So after the operation, the recovery is very, very fast. Okay, this one thing. Secondly is that the hair do not drop. This is chemotherapy. You go for this thing, and the ulcer. Some people, when you go for radiotherapy, the what they call the foot develop a lot of ulcer, a lot of ulcer, a lot of this thing do not develop. That's a good thing about this thing. Then now also we already give this powder to the market. Okay, so instead of 30 RG, 30 GL, you get the mixed powder, about 30 grams. Okay, then mix with what you call with Morinji, with or Codify, then drink in a thick solution now, drink slowly, and then also the throat, there was many chemo, actually for this chemotherapy. After that, many of them, they have this throat and ulcer problem, and this is very good for that. Okay, so that you only go for mega doses. That is the only dosage for the cancer patient.
How long these doses to be continued? How long?
Question to ask now. Actually, it's not how long is the thing. How long the body can recover. Okay. Normally, after 3 months, you can see very good result. When you see a good result, we can reduce this thing. But some cancer patients, in my experience, some of them even take to 3 years, 5 years, mega dosage. Then finally they become better. Okay, so how long it is to take is not we do not have a definite answer. But cancer patients normally we review every 3 months. No, it's a long term. Like COVID is a short term. We review every 2 weeks. But cancer every 3 months. See whether the cyst has what they call, is it become smaller? Okay, see what are the parameter. This thing. So if the parameter is improving, then we can reduce the dosage. If the parameter is not inducing, we continue the mega dosage. Yeah, doctor.
Thank you. Thank you.
Yeah.
Thank you so much. And it seems now we are going to touch 100 minutes of our discussion, and it's a long discussion. So before we close, I don't see any questions right now coming up. So just to summarize, doctor. So along with the current management that WHO or the governments are prescribing, the management that we are talking about is food, supplement, and also lifestyle that we want to incorporate, especially by incorporating, herbs that can actually help combat the flu. Talking about flu, let's not call it COVID virus or kind of a flu, and we are trying to combat that. So to summarize, one is we induce perspiration. Second, second would be to make sure. Yeah, please, doctor.
First the flame.
Yeah. So purge the phlegm, induce perspiration, and I think you doctors, everybody have a list of herbs and medicines, even in modern medicines and everything. We can use that with our what we call yukti praman or our upaya, that we call a little application of our own wisdom, and we get that, and we can use that in combination with your current medicinal practice and incorporate that. And we would be very glad to have you with Dr. Lim join a panel of volunteers when we fight this special crisis that India is facing, and we will then support you in whatever possible way that you need in your clinic, make sure that we provide you with all the subsidized rate GL and all those things, so that you can help the patients. And doctor, so any concluding message you want to give before we end this session?
Yeah. I think today we have a good session here. Okay, we already introduced the type of fruits and what is a simple method. Of course, Rajesh, we believe in integrated medicines. The doctor feel free, to use whatsoever method they feel that can help the patient. Okay, they know there's no contradiction with our system, So because in our this group, there's some doctors who give us some what medicine they're using, what a good effect. We can share among all the doctors now. The only thing is that we are not allopathic doctors. We are not allowed to use this kind. We only allowed to use the OTC. So I don't want to talk more about the medicines, because I don't want the member started to prescribe medicine when they are not doctors. That is against the system. Okay, so that our doctors can go for integrate with the practice. Okay, they feel free, to give whatsoever this medicine that they feel that is good for the patient. So that in a sense that we do not force people. They must use our system. They must no such thing. We only advise people to that. So I hope in this case, like the history, there's so many times this flu have been in China, and they're suppressed completely with COVID. Now you see the China now they're free of COVID. Very few people know. They use the formula I told you excessively. Okay, to dilate the lungs, to take care of the stomach, to induce urination. Maybe the next series we're going to talk about that. What are the formulation they are using? And today just a foundation course, okay. And then the next series, then Rajesh, you can use the formula that I give to you, Okay, we can expand on that. So today maybe the time is not too strong, but never mind. We have the time, we can do it in a series. So Rajesh.
Thank you so much, doctor, for giving us time. 100 minutes of yours is really valuable, and I'm sure we all have benefited in some way. I have to definitely benefited. My family is secure, my friends are secure, and my colleagues who know me are all secure because of the advices that I've got. And I'm sure if you can understand that, you can use your permutation and combination of the herbs, medicines. It doesn't matter what you use. The most important thing is the wisdom that you apply behind it, and that is what matters. When, like for example, the phlegm needs to be out. If it's going to be in and you're going to give oxygen, it's not going to help. The temperature needs to be managed. You cannot put a COVID patient in an ICU with in an AC environment. That's going to be very, very horrible. So all those things, when you understand and apply those things, you will realize why drinking even our coffee and tea is so useful, and why taking herbs that can actually help in as a diuretic, so that we can flush out the toxins. Because what doctor told me is very important, that when you do exercise, what comes out from your skin is water. So you have fluid loss with salts. But when you perspire, when you take herbs and you take soups and all those things, that is detoxification. And that is when the toxins are going out. So that difference is, again, it's the way you apply what you learn. And thank you, sir, doctor. So maybe this forum of doctors, we will come together. The numbers will keep on increasing. I will get all these content also transcribed with our content writers, and make sure that our website will, we are coming up with a website called dxncares.com or .org, in which we will appreciate all of you doctors to participate and help India in this crisis situation. So before I go, I would like to even thank Rafiq so much, because he's not feeling well, but he still managed to sit on this blue couch and give us time and arrange this whole special session. Thank you so much, Rafiq. Any concluding message?
Yeah.
Yes, sir. So I would like to request Rafiq sir, please say a few words and say thank you to Dr. Lim.
Yeah, thank you. Thank you very much. Thank you very much, doctor. Thank you very much, Dr. Savera. So it's a wonderful session, and of course I am back. I am back to work. I am in office, Chennai office now. So we are doing very much fine with the help of RGGL and Spirulina. And today the session was a very good, especially where this is the beauty of the doctor, where he put and encapsulate everything into a small formula, where it go for 1246 or mega dosage, or for the perspiration. So it can be easily duplicated, and people can use it in a different way. So thank you very much, doctor, for your wonderful time. And we are looking for the next session. And maybe in 2 weeks or 3 weeks time, we'll be having one more session with you. We'll take your time and we'll continue this series. So thank you, Dr. Savera, and thank you, Dr. Lim, for your wonderful time. Thank you.
Thank you. Bye-bye. Thank you.
Bye-bye. Thank you.
Thank you very much, all the viewers, all the respected doctors. Thank you very much for giving your precious time. And I hope that this session is going to be really wonderful and will help you a lot for the humanity and during this COVID pandemic time. See you again. And I would like to request all of you, be safe and keep using the DXN products, and be healthy.